Good morning, good afternoon, everyone, and welcome to the first series of rapid support on COVID-19 related waste management technical assistance. Today, we're launching the first webinar on effective management practices for COVID-19 related healthcare waste. I'll now pass the floor to Merle, our moderator, who will start presenting.
Thank you, Paula. Good morning, good afternoon, good evening to all those who are joining this first of the series of webinars on COVID-19 linked waste management. In fact, this is the second series of waste management linked webinars which United Nations Environment Programme is conducting since COVID-19 happened last year. In our last year series, which started in June 2020, we had provided guidance to people from local municipalities, hospitals, healthcare workers, waste management experts, waste recycling experts on how to deal with a pandemic-linked waste management issues. 12 months from then, we have passed through 1, 2, and often 3 waves of COVID in many parts of the world. In some parts of the world, including India, now it is going up on a second wave. So the challenge of COVID-linked waste management remains. But we have also learned a number of lessons in the meanwhile. So today we are starting a new series, which is not only providing the basic information to experts around the world on COVID-19 linked waste management, but also the lessons which we learned in the last 12 months. Last May, 2020 May, we had produced a series of guidance notes on waste management. They were available on our website. They have been provided as handouts to this, and all of you can download those sessions. We have produced updated guidance notes that's also available for you to download. All of you, we have more than 600 people who have registered from 46 countries when we checked last. You are encouraged to ask questions at any point of time on the Q&A section. We are constantly monitoring it, and we will answer them in real time, as well as take up some of those questions in the end. We today have 3 presentations covering 3 separate angles, and we'll have each of the presentation about 15 minutes, and the questions and answers would come together in the end. All of you who participate in the webinar and complete the webinar in the end would actually get a certificate. So those who wish to have it, please complete the questionnaire in the end. So it is my pleasure now to invite Mr. Mike Caving, who is an internationally renowned waste management expert, to deliver the first webinar. Mike has over 30 years of experience in over 50 different countries, dealing with waste management, both urban and industrial. He also has experience in providing waste management advice after disasters and conflicts. And he has been on the front end in the Gaza Strip, in Lebanon, in Japan after the tsunami, and he's leading a project in Nigeria. Mike would talk today about the factors influencing COVID-19 related healthcare waste management. Over to you, Mike.
Okay, thank you very much, Murali, and good day to everybody, wherever you are in the world. As Murali said, this brief presentation will just be an overview of those factors that we need to be mindful of and some of the lessons we've learned when we're trying to plan for the management of COVID-related healthcare waste. Now, the good news is in this respect is that with COVID waste, it needs to be managed in a similar fashion to all hazardous healthcare waste. So we're not reinventing the wheel, as it were. We're not doing anything different. We've got to relearn and reapply those rules, those policies, those procedures which are already in place for the safe management of hazardous hospital waste. Now, we know over this period of time that the pandemic has significantly increased the amount of hazardous healthcare waste being produced, and this has overwhelmed in many instances the existing waste management infrastructure. We found that in the developed world, with its more robust developed systems, that was better able to cater for the increased volumes. But within the developing world, in many instances, the fragile infrastructure and equipment has been completely overwhelmed and overrun. And we'll look at some of the contributory factors and perhaps some of the things that we can do to address those sorts of challenges. Just to put some of the waste management statistics into some sort of perspective, cities following the first wave, cities such as Wuhan, Manila, Kuala Lumpur, Bangkok, they actually reported a quadrupling of the generation of hazardous healthcare waste. So that obviously brings with it increased pressures on the systems and the people involved in managing and receiving these waste streams. Also, we've had an increase in domestic waste generation directly attributed to the lockdowns, the change in patterns, change in consumption, and people spending more time in their residences. So there's a change in the actual structure and nature and volumes of the waste having to be managed by the various authorities. In addition to which, we've had some other global factors. We've had initially a fall in demand for hydrocarbons, a plummeting in the oil price, which actually made the production of, let's say, virgin plastics cheaper and in many respects more attractive than what was the ongoing plastics recycling market. So recycled plastics became less attractive in the marketplace, virgin plastics more attractive, cheaper, and more broadly used. Some of the production factors or figures bear this out, and that, for example, single-use face mask production in China was reported to have increased by a factor of 12 shortly after the first wave, and that equates to something in the order of 116 million single-use face masks being produced on a daily basis in China alone. Now, if the global population adheres to the standard recommendation of using one face mask per day post-lockdown, as a result of the pandemic, that could actually equate to monthly global consumption and waste of something in excess of 129 billion face masks, 65 billion gloves. And just to recoup, that's actually a monthly figure, not a total annual figure, it's a monthly figure. So simplistically speaking, we're dealing with a lot more hazardous waste, we're dealing with more single-use plastics. And this has stretched many of the waste management infrastructures to breaking point, to being overloaded in many developing countries. When we're strategizing, when we're planning, although hospitals only make up about 1% of actual healthcare facilities, they are very large generators of the hazardous healthcare waste that we're interested in. So probably accounting for more than 70% of hazardous healthcare waste generation. So in terms of improvements and in terms of introducing incremental steps to improvement, if we can focus in the first instance on the large generators, on the large hospitals, then we're going to make very significant inroads into managing the healthcare waste that's generally produced. As I mentioned, just to re-emphasize the changing dynamics, the changing face of waste, that individual choices during lockdown, again, particularly in the developed world, have changed the waste profile. People dining at home, takeaway, higher plastic demands. And this is reflected also in a global plastic marketing increase of 5.5% on the year following the pandemic in terms of the pandemic response. So it's safe to say there's something in the order of 5% more virgin plastics entering the global waste streams. In addition, we've seen pictures from around the globe of COVID-19 PPE, personal protective equipment, in the marine environment, washing up on the shorelines. And this is actually contributing to complicating the challenge of curtailing microplastics in the marine environment. So we're looking at a number of impacts around the globe of very different nature, but again, root cause coming back to the need to properly manage the COVID-related waste pandemic. Now, a lot of literature has been produced, a lot of academics have addressed the challenges of waste management in the pandemic, and also thinking more broadly about factors affecting sustainable environmental restoration post-pandemic and the strategies therein. This simple graphic here shows 8 potential focus areas for environmental sustainability, including the renewable energy, green public transport, etc., etc. The one that is most relevant to us is the balloon at the base there, waste recycling, waste reuse. And it underscores the fact that in terms of our sustainable recovery and development post-pandemic, waste management is right up there in terms of some of the most important considerations to be addressed. Next slide, please. Now, when we're planning for COVID waste management, as indeed planning for hazardous healthcare waste management generally, we need to adopt a cradle to grave mentality, by which I mean from waste generation to waste disposal, the whole chain of utility, which means that when we're planning, when we're strategizing, we've got to be thinking from waste generation, waste segregation, color coding, use of proper containers, waste interim storage, collection, transportation, and then final disposal. So it's a whole chain of utility, each of which has to be addressed in our planning and in our formulating our waste management plans to how to deal with the COVID-related waste. Now, in so doing, there's no one plan that we can take and pluck from one country and use to another, because each plan has to be catering for the local environment. It has to be in compliance with local and national legislations and guidelines. And the plans have to be catering for factors to support its implementation. So we need to be looking at what are the existing practices, what are the existing facilities available to us, and we need to be thinking about training the healthcare staff and indeed the waste management staff in terms of the correct procedures. So I would say, irrespective of where we are in the world, whether we're in a developed country or developing country, we need to plan, but I would suggest that perhaps the most important component of any plan for waste management of this nature is proper waste segregation. So if we get it right early on, if we identify the hazardous waste, the COVID-infected waste, identify it, segregate it, and handle it accordingly, we've actually then come a long way in preparing to manage it. And what's happening very often, time again, is improper segregation, that non-hazardous waste within the healthcare centres is being mixed with COVID-infected waste, and in so doing, greatly increasing the amount of waste that needs to be treated in a special capacity, and in so doing, that significantly increasing the operational costs and putting further burden on the system. So the starting point really is good waste identification and segregation at the point of generation within the healthcare facilities. Once we've started to introduce proper handling, proper segregation, really the starting point is segregating the waste into the appropriate color coding. So that means we've got different colored containers, different colored bags for that waste which is identified as being infectious, hazardous waste, typically going to be going into a yellow container, yellow bag. And then also we have to remember that healthcare facilities are generating a lot of waste, which is not infectious. Something like 75 to 80% of the waste generated, if properly segregated, can be treated as non-hazardous. And it's very important to get that definition and to get that segregation operating as quickly as is possible. Sharps, by which we mean syringes and the needles, they go into puncture-proof containers because of the secondary risk of contamination, because of the risk of needle stick type injuries, which sadly are very common around the globe. Once we've got our segregation in place, once we've got our color coding in place, we then need to ensure regular collection of the waste within the healthcare facility. We don't want the waste sitting around in warm conditions for more than a maximum of 24 hours. So we should have a daily collection within the facilities from the point of generation. Now, not all waste is for disposal. Some waste is for reuse. For example, if we talk about linens, bed sheets, and what have you. Now, this is relatively easily taken care of, that if we have a machine wash for the linens sustained at a temperature between 60 and 90 degrees, then that's going to destroy, is going to kill the pathogens that we're concerned about. However, if we're not looking at automated washing, if we're in a developing country scenario where we're looking at hand washing, then the good news is, even with hand washing, followed by a 30-minute soak using 0.5% chlorine solution, a typical bleach, then even after only 30 minutes, the pathogens, the virus is destroyed. So surprisingly, or perhaps counterintuitively, this virus is actually relatively easily killed or destroyed or enabled by these routine activities. We'll talk a little bit more about that as we go on. Next slide, thanks. Now, when we talk about waste storage within the healthcare facility, the basic storage facilities need to meet certain criteria. And they need to meet this criteria because, again, we're trying to reduce the risk of contamination, of spreading the virus. So the storage locations need to have a number of basic criteria. They need to have impermeable surfaces which can be easily cleaned and bleached, sterilized. The storage facilities, to facilitate that cleaning, need to have access to water supply. They need to be secure from disease vectors such as rats and flies and birds. Again, for safety, we need to have adequate lighting to minimize the risks of injuries of the personnel entering and departing from the storage facilities. And we need to have passive ventilation. Passive because that irrespective of power cuts and what have you, we need to maintain a good degree of ventilation within the storage facilities to keep the temperatures manageable and to reduce the breeding of any vectors therein within the facility itself. They need to be disinfected on a daily basis. Again, relatively straightforward. We can use a 0.5% sodium hypochlorite or a typical bleach solution, which will inactivate and kill the virus of concern. And indeed, we need to control access to the storage location. We don't want patients and members of the public wandering in, and we need clear signage. The photo on the right there is illustrating a very common storage of waste within healthcare facilities, but the sort of facility which we need to be avoiding, which is open to the environment, open to being tampered with, open to pests, and contributing to the spread of the virus. Next slide, thank you. Once we've segregated and stored safely and transported, the next line of utility is waste disposal. The next consideration is waste disposal. Now, there's many different waste disposal options out there, and we're going to talk in greater details about what are the merits, the advantages, and the disadvantages of the different technologies at a later webinar. So we're only talking about it superficially at this stage, just to give you an awareness of what some of the disposal options are. And I put them into two categories, and I take it in reverse order. There's chemical treatment, which we've been talking about throughout this presentation, which is typically in the hospital, in the healthcare environment, the use of bleach to clean the cleaning surfaces, the working surfaces, the PPE equipment. But also bleach chemicals can be used at the disposal stage, and we'll talk about that a little bit further. But the main category of waste treatment facilities and equipment would fall under what we call thermal, of which there's typically two categories. There's low heat, typically between 100 and 200 degrees centigrade, which would cater for the autoclaves, the microwaves, and steam sterilization. And then there's high heat, which is typically in excess of 800 degrees centigrade, in which we have incineration and pyrolysis and gasification. Now, there are other technologies on the market. I've chosen not to discuss those in detail. The reason being, a lot of them are peripheral, a lot of them are still evolving, and don't have long track records of successful application. And I think in this emergency pandemic environment in which we find ourselves, we don't want to be investing in developing technology. We want things which are robust, pragmatic, and are proven to work. Also, when we're looking at what technology is available, what technology can we use, we've got to be looking at factors such as compliance with national and local guidelines. We've got to look at what's the environmental impacts, what are the effects of social considerations, and also employment considerations. So in an environment where there's a lot of unemployment, where there's a lot of manual labor available, it's not the best thing to do to move to a fully automated system. In so doing, you're not creating the career opportunities, the job opportunities which would be desirable. Moving on. Murali was mentioning at the start, there are a number of UNEP publications available for your help, for your guidance. And when discussing, when considering your best disposal options, this link on this slide here will take you to some publications again from UNEP, which help you look at what are your disposal options. And it goes into the merits and the demerits of the different technologies available, and importantly, talking about cost and affordability and operating costs as well. So some recommendations there for some of your reference reading, which will help in this process. Next slide, thanks. Talking about one particular technology under the low heat technology, which is autoclaving, also known as steam sterilization. Now, I have to confess that after many years in the field, autoclaving is my go-to technology. It's my preferred technology. Reason being that it's a cleaner technology. It is robust. How it actually works is it's combining elevated temperatures with pressure, so we get a more efficient temperature treatment within the vessel itself. And the modern autoclaves, which is a very important development, also incorporate cutters or shredders, so that the hazardous healthcare waste is cut and shredded before it goes into the chamber, and that gives us a much more efficient kill of the pathogens. But also it gives us significant, usually about 80% reduction in volume, and it's generating an inert material which then can go to the local disposal site. Advantages are, as I say, it's robust, it's pragmatic, it's proven to work. And unlike incineration, it's not generating a second waste problem through the generation of either toxic emissions through a chimney or toxic emissions within the ash. So it's a cleaner technology. If there is any disadvantage from operating autoclave steam sterilization units, is there can be a nuisance caused locally through odor. But the good news is the odor problems can be addressed by using filters which would typically come with the installations.
Mike, if you could speed up a bit.
Sure thing. Another problem with autoclave is that they can be damaged by some of the different waste types. For example, I'm helping a country in Asia presently. They invested in autoclaves. The autoclaves broke, and it comes back to my earlier point of waste segregation. They broke because coconut husks were being added into the waste, which was actually breaking the blades, breaking the cutters. So it comes back to waste segregation. Now, there is a large application and use of incineration around the world. They are an established technology. However, they are comparatively expensive, and they do come with complications, which is, if not operated properly, we are going to be generating a secondary problem of furans and dioxins being emitted via the stack. If we have stack control issues, then those contaminants are transferred to the ash, and we have a secondary ash management problem. We'll talk about these things in more detail in a follow-up webinar to be looking at these disposal issues in greater detail. I won't dwell on these slides, but it's to say that if we're in an emergency situation, there are cheaper versions of the incineration, such as the De Montfort brick incinerator, largely which can be considered a stopgap measure or an interim measure till we can have a longer term, more sustainable solution. Moving on, as an absolute bottom line, if we're in a situation, as many in the developing world are, where we have no access to waste disposal, then the waste has to be removed. It has to be taken to a disposal site. It can't be randomly disposed of. You have to excavate either with plant and equipment or by hand, dedicated trenches, clearly marked, keeping waste pickers, keeping members of the public away, and treat it with dilute bleach on a daily basis and cover with waste at the end of which, if you can, it's better to have a mechanism whereby you can close the trenches, perhaps with a lockable lid or something, but not always available. So at the end of each day, covering with cover material, soil or sand or something of that nature. Bottom line is we want to move away, and we want to discourage at all costs open dumping and open burning. Next slide. At no point, as we've said, should they be dumped because of the risk of infection to waste pickers, hospital workers, and the waste management staff. Next slide. I'm rushing through to conclude now. So there's a question, which is, we've talked about COVID virus being relatively easy to kill. We've talked about that 0.5 or 1% concentration of bleach will kill the virus, 70% ethanol will, hydrogen peroxide, and washing in water for over 70 degrees. So that being the case, we can conclude that autoclaves operating at 100 degrees centigrade is more than sufficient to kill the virus. And it raises the question, why are we incinerating a lot of this waste, incineration at 800 to 1,000 degrees, when temperatures of 70 to 100 are actually proven to kill the virus? That's food for thought for a future discussion. There is an aid to this presentation, which is, you can't see on the screen, but we can share with you. It's a checklist to help you within your healthcare facilities start to produce your health plan if you don't have it, your healthcare waste plan. It's a checklist that you can go around inspecting the generation, segregation, color coding, labeling, storage, use of containers, etc., etc. That should be a useful tool for you. Next step, the real challenge is that of financing. I am advising and helping some ministries of health in this. There are options if funding isn't available, options such as going to the Global Environmental Facility, the Global Fund, the Joint Sustainable Development Funds, and there are also multilateral agencies such as the UN, the World Bank, and the UN, and bilateral and private-public agreements to be explored. So funding is the key. I suggest that you get starting on this as soon as is possible because it has a very long lead time. The starting point of this is generating statistics about how much waste you're generating, what are the different categories of waste, and build up a comprehensive picture which the potential donors are going to need when they're producing the project plan. But it's going to be about an 18-month lead time. My advice to you is start sooner rather than later. Now, I can see Murali looking a little bit stressed there. So if I move on to my final slide, which is a recap of the recommendations, is that healthcare facilities have a duty of care to act responsibly to protect the public, their staff, and people in the waste management sector. The best way that they can affect or honor their duty of care is to develop a hazardous healthcare waste, a COVID waste management plan, establish a committee to develop the plan, to implement the plan, make a senior manager ultimately responsible, because without responsibility, then very often if people are not responsible, they're not going to honor those responsibilities. Appoint a waste management officer who will conduct the inspections, train your staff, review your plan, modify it, upgrade it as necessary. So that's me concluding. It's been a very rapid run through many of the factors, the multifaceted factors we need to think about, but I'll happily respond to any questions at the end of the session. And back to you, Murali. Thank you very much.
Thank you, Mike. I know it's almost unfair to ask somebody with so much experience at a point of time when the world needs so much of his expertise to condense all the speech into 15-20 minutes. But since we have other speakers, as well as conducting more than 90-minute sessions are not considered good in online, we are compressing a bit. But as Mike said, he's available to answer your questions while the webinar is on. You can do it on the chat, but also hereafter, we are going to establish a platform where you'll be able to continue to ask questions for the next 3 months. And we'll give details of that after the webinar once we set up the system. We now have the second speaker for the day, Mr. Ravi Shankar, who has a master's degree from the Indian Institute of Technology and over 30 years of international experience in waste management as well as regulation. He was with the nuclear regulator in Canada. He has been a consultant to the United Nations and has worked in a number of countries, including Iraq, Congo, Ethiopia, Nigeria. And Ravi will talk today about medical waste management, strengthening the regulatory framework. Once again, lot of experience since the start of this pandemic. So over to you, Ravi.
Thank you, Murali. Good morning, good afternoon, good evening, everyone. I noticed by looking at some questions that some of you are quite familiar with the regulatory field as well as some of the guidance, international guidance. So I know that this is a mix of audience, so I'll try to grade my presentation accordingly. So next slide, please. So today's presentation basically is going to look at why we need regulatory strengthening and some of the basic principles of regulation making and the kind of stresses that the pandemic has brought in and what can be done, what needs to be done by authorities going forward. So that's the overall presentation structure. Next slide. The question is, why do we need regulatory strengthening? As you know, in the last year and a half, suddenly the pandemic has thrown out a number of assumptions and standard processes. And what we have seen is that the crisis is evolving. Science is also evolving at the same time. Our understanding of not only the virus, but how it transmits and the kind of waste that is generated because of that, the environmental impacts on all of that is also evolving, and people are becoming more and more aware of it. That means that not only the general public are afraid of things, but professionals are also concerned about the situation. And then along to mix with all of this, there is the jurisdictional inconsistency, which means, people who thought that they understood the division of responsibilities between one level of government and another suddenly are now debating whose responsibility it is, and that becomes a challenge. And then, of course, the poor understanding of the interlinkages between the various elements in the regulatory domain. So that's the reason why we need to look at strengthening the regulatory framework. Generally speaking, the regulatory guiding principles, there are 5 of them. Polluter pays. I think most people know about this. If you pollute, then you are legally and financially responsible for safe and sound disposal of waste in this case. Precautionary principle means that just because you don't know everything to know about something doesn't mean that you can't take action to try and protect the environment and prevent its degradation. The third one is duty of care. Anybody who handles or manages waste has got the ethical responsibility of using utmost care in handling this. Fourth one is proximity. Proximity is, if you are generating waste somewhere, try and treat and dispose that waste as close to the source as possible so that the transportation and the hazards of transportation can be reduced, and other regions and other communities don't get exposed to this kind. And we see that quite a bit in all sectors. You probably have read about the nuclear sector and the source generation and the waste disposal there. Quite controversial. The other one is prior informed consent. And because of past experience and past international experience, basically what has been recognized everywhere is that the communities and the stakeholders have a right to understand, to know what's happening, and also to provide consent to the operations, whether it's transportation, siting, waste treatment, disposal facilities within that region that affects the community. So prior informed consent is also one of the guiding principles. Next slide, please. So there are many international guidelines. Mike spoke about the UNEP guidelines and fact sheets that are available. I'm going to also mention that World Health Organization has got a number of specific documents related to healthcare waste management, really well done. They have been thinking about this for some time, going as far back as 2004. There's a good document, but the 2014 document is really comprehensive, looks at all the various healthcare waste generated, some of the options, technologies, and the legal framework as well. And then the latest one, there is an interim guidance in June or July of 2020 that they have generated in order to address the COVID-19 pandemic related waste management. So, of course, UNEP biomedical and healthcare waste management technical guidelines are available, and then there is the International Solid Waste Association ones. And at the end, I have given a link to the WHO website, and if you go there, you'll be able to access all of these international guidelines. Next slide, please. So in addition to those guidelines, which need to be adopted by various countries and followed, there is international treaties that member countries have signed on to. The most important one from a hazardous waste perspective is the Basel Convention. Basel Convention is an international treaty for transboundary movements of hazardous waste and their disposal. A similar one, but limited to Africa, is the Bamako Convention. There is persistent organic pollutants that are released because of some of the treatment technologies. For example, the medical incinerators or open burning, and for that there is a Stockholm Convention that monitors and regulates it. And there are a couple of other ones. The last one is Aarhus Convention by UNECE. You will see that there is a recognition of the importance of public participation and information dissemination to public on this. So it's quite comprehensive, but each country has to adopt them and generate enabling legislation for that. At a country level, the ground reality is that the laws and regulations, and it is broad, as you can see, it's quite broad. The laws and regulations are managed at different levels. The typical breakdown is that at a national level, anything related to overarching laws and regulations on environmental protection and economic activities, public protection, those things are put in place. Which is used by the regional, state level, provincial level governments to enact regulations in order to take ensure compliance by various sectors like hospital activities, waste disposal facilities, etc. And there is also local enforcement and resource harvesting. When I say resource harvesting, I'm talking about mining activities for metals and whatnot, but also source water protection for future. So this is important from an environmental perspective. If there is an activity, I'm just taking an example from what Mike said. If there is a sudden urgency in disposing, in fact, hazardous waste over some place because nobody is using that area, let's just dump it there. Who knows what the future use of that area is? Maybe there is a major groundwater source there that would be of use in the future 50, 100 years later. So it's very important to take all of these things into consideration when looking at regulations and permitting and compliance oversight. And then at a local level, typically there is fire, water supply, wastewater treatment, recycling. So municipal governments are typically responsible for that. And in terms of enforcement, so those were regulations and enabling legislation. Now comes enforcement. Each jurisdiction has got enforcement teams and enforcement agencies. For example, at the national level, typically you can think about Customs Department trying to keep an eye on what hazardous wastes are being sent into the country and whether they meet the international regulations, international treaties that were accepted by that country, by the member state. At the state level, hospitals may be audited to make sure that there is a good waste management program, environmental measures are in place and are practiced. And at the local level, the recycling practices or wastewater discharges may have to be verified. So there are enforcement agencies with a lot of powers, which is almost like a police agency. They have the power to stop activities. They have the power to fine organizations for non-compliance, etc. Next slide, please. So the thing to remember at a country level or in any particular region is that just having laws and regulations does not mean that there is effective compliance. This is crucial. And there are many reasons for it. There are gaps in laws and regulations. People think that they have a law that is applicable, but it may not be. And that's what people are discovering now. Poor enforcement practices because there is not enough people, qualified people who understand what the compliance requirements are, and so poor enforcement practices, inadequate consequences for non-compliance. What happens if an industry does not follow and dumps hazardous waste around, and if there is no consequence, they will continue to use that or practice that bad habit. And then there is the lack of awareness in the community, and we see that in many countries with the hazardous waste and pollutants people living thinking that this is the way it is, whereas maybe there is a regulation that bans that kind or prevents that kind of pollution, but people just don't know, so they don't object. Shortage of resources, qualified personnel, and or infrastructure when there is a high need. Shortage of political will, and of course we all know what that is. Next slide, please. So given all of that, now suddenly there is this pandemic, and Mike has spoken about increase in volume. WHO estimates that medical waste volume increases by about 5 times during a pandemic, and maybe the latest information that Mike has is it's even more. And most of that increase is because of disposable personal protective equipment, that such as masks and gloves. And then, so on the one hand, there is an increase in waste volumes. At the same time, there is a decrease in available services because of the stretched resources. Recycling activities sometimes are delayed or canceled until things get better again. So, and what happens to that unsorted waste, right? And then there is the available personnel and equipment that are severely stressed, either because they are sick and not available, or because of lockdowns, they're not able to go to these places to handle things. So, and of course, equipment require regular maintenance, and all of those challenges continue. So what we have seen so far is that, pandemic has just exacerbated existing problems. What are the various links? We know that there are stakeholders, so people that are producers, consumers, general public, workers, government. They all have a stake in this because they are affected one way or the other. Infrastructure, there is, as Mike mentioned, waste collection, storage, transportation, treatment, disposal. So there is the need for proper infrastructure and regulations related to standard approaches that are acceptable. And then there is the knowledge component of it, public participation and awareness. As we have seen, there is a data collection. So by that I mean what concentration of a certain pollutant is going into the wastewater, or what levels of hazard components are there in the waste that is being disposed, etc., or air pollution, and then the receiving environment. Then the issue about qualified personnel, when there is a dire need of people who need to do certain things. Right now, for example, we are facing a shortage of people who can actually administer vaccines, which is not waste related, but you can see that they need to be trained and they need to be sent out. So there is that additional need for qualification, proper qualification, and personnel that need to be hired, qualified personnel need to be hired in order to do the activities, conduct inspections from a regulatory perspective, and enforce them. And then, of course, the last part of it is quality assurance. There needs to be reporting requirements so that people who are regulators, they can see what is happening, how well it's being done, are they doing things properly, so that they can make policy decisions further. They are all interconnected. So next slide, please. So in addition to all the interconnected matters with respect to waste disposal, there are also non-waste related cumulative impact. For example, we have been hearing in India that because of increased deaths during the last few days, there is no space for cremation, no space for burial. People are running out of burial space. And so there is all this cremation happening, which increases the air pollution. They are running out of fuel. There is people go and cut trees in order to burn bodies. So there is open burning, uncontrolled burning. There is a severe increase in air pollution, and that's also seen in other places, not just in India. So loss of waste storage and disposal space for the regular needs, the regular waste volumes is not necessarily going to disappear. So which means what happens to the regular waste? And then there is the Shortage of fuel. I mentioned the people going and indiscriminate cutting of trees. I have seen video clips of people using hay in order to use that as combustion fuel. Regular petroleum fuel and all of that is also in short supply. So in addition to all of that, there is the infrastructure shortage and people shortage. People don't care about enforcement because there is so much of pressure, time pressure, space pressure, and all of that. So there is lack of enforcement too. Prioritization of enforcement becomes a major interlinkage. Next slide, please. So if you are a regulator, a policymaker, and looking at all of this, then what you need to be looking at is, okay, how do I handle this right now in the interim, and how do I deal with this in the long term to ensure that we are going to be ready for a future pandemic or a future stress. And the good news in all of this, as Mike mentioned, is that the technologies that are required in order to handle the pandemic related waste is not that different from what is required during normal times. But the challenging part is that strengthening regulatory framework touches upon many regulatory needs. So it's not just dealing with environmental protection or healthcare. It is also dealing with, as I mentioned, public awareness, qualification, health and safety of workers, many different aspects. And then the other aspect is the regulatory framework needs to be nimble and flexible, because what is a good solution for one corner of the country may not be for another corner of the country. So the framework, it needs to be flexible enough that people can take that, achieve the end goal, but also have the flexibility to use different options. Then, of course, the jurisdictional separation, the confusion needs to be removed. It needs to be clear as to who is responsible for what, and empower them so that they can go ahead and take care of their regulatory responsibilities without having to wait for another jurisdiction, another agency to come on. So next slide. So coming to conclusions, again, the regulatory jurisdictions, it is not easy. It's not a one-day job. In fact, it probably is going to take a year or several years in order to deal with this. The first step is to conduct a review of the existing laws and regulations and identify the gaps. But the gaps, as I mentioned, is broad-based. Waste management processes, infrastructure development, personnel qualifications, worker health and safety, environmental safeguards, public awareness campaigns, consultation process, waste separation, segregation, and recycling needs, effective inspection and enforcement regimes. All of these have to be looked at holistically, and then develop a regulatory improvement plan of action, and then get that approved by the government of the day or the parliament, whatever the case may be, and have that action plan approved and ready and based with the timelines and all that. And with that, then comes the next stage of drafting new regulations to fill the gaps or update existing regulations to do so. And then also develop policy documents and technical guidance documents. A lot of that technical guidance and recommendations are provided by UNEP as well as World Health Organization. The link that I have provided below is the one for W Health Organization. And once you go there, you can go to various links and you'll be able to see that. So that's been my slide presentation. And next slide. Thank you. I appreciate your time. Thank you. Murali, over to you.
Thank you, Ravi, for this presentation. In the last series of webinars, we actually did not speak about regulation. It was more about practical actions one can take. Partly because we felt that when there's a pandemic raging, it's really not the time to talk about regulation. It's about providing instant guidance. which is of course right at that point of time. Now that we have 1 year of experience, it has taught us that while we could provide a lot of guidance, effective implementation will also depend upon having regulations in place. So those countries which are coming out of the pandemic, and as they make their recovery plans, it is important that they strengthen the regulatory system, because COVID or otherwise, disasters would come in future, and they should have regulatory framework in place so that it can be enforced. There is a question among many of the questions which are coming about whether there are places which are actually following the WHO guidance. Absolutely, there are hundreds of thousands of places. So it is not that one particular hospital or a city or a country follows every item on the WHO guidance. Certain elements of that would be extremely useful and handy, and they would follow it. And certain other elements may not be appropriate, may be difficult, etc. And that would take time. But certainly this guidance note provided at the right time certainly would help hundreds of thousands of hospitals and municipalities to handle their healthcare issues better. Thank you. We now have the final speaker of the day. And I must say that we have an exceptionally good retention of participants who came in. We almost have 95% of the people who joined are still in the session. Thank you for that. We will have an opportunity for an interactive session. So before that, we have the final speaker of the day, who is Ida Eriksson, is a Swedish environmental consultant currently working with WSP Sweden with 15 years of experience as an environmental expert. She works currently mostly with the water and wastewater related issues. She works part-time for the Swedish Contingency Agency as an environmental field advisor and a water sanitation and hygiene expert. She has field experience in CAR, Central African Republic, and Sudan. She also trains other MSB staff. During the first wave of pandemic, UNEP had deployed, with support from MSB, 6 environmental experts around the world, and Ida was one of them. And today she would speak about her experience in Sudan. Over to you, Ida.
Thank you, Murali, for the introduction, and also thank you, Ravi and Mike, for your interesting presentations. I think we can skip to the next slide. Yes, please. Hi, everyone. I am a Swedish environmental expert, as Murali told you, so I think we can skip to the next slide to rush on a bit so we can have time for questions afterwards. I have been invited here to talk about environmental risks through medical or healthcare waste. I have been working on a report for UNEP Sudan about environmental assessments and recommendations following COVID-19, and I will show you some of my findings that can work as an example from the field about what Michael and Ravi presented, even if it was not exclusively about healthcare waste. So this might not add more knowledge to what earlier speakers discussed, but more function as a field study. And you can take the next slide. And first, some orientation about Sudan. The country is bordering the Red Sea between Egypt and Ethiopia. And the capital is Khartoum, which is marked with a red dot, as you can see. And there are several conflicts in the border areas, the latest one with Ethiopia, and also some internal unrest, the latest in West Darfur. And there are several refugee camps with many inhabitants in these affected areas. And there are several camps, I think, still active for people sheltering from the effects of massive floods in the fall of last year. So many people also lived in crowded suburbs surrounding Khartoum. And we know that crowded camps with poor sanitation and food insecure inhabitants are many risks combined for the spreading of COVID-19. Next slide, please. And these are the reported cases of COVID-19 in Sudan. The outbreak seems to hit the Sudan region less severe than several other African countries. But it's interesting to look at case fatality rates as well. It was 6.23 in December, 6.23% in December, which means how many died out of the confirmed infected. So you can say that if the case fatality rate is 100%, then everybody that gets it dies. There is a variation in case fatality rate, which in some cities like Khartoum was low. It was 3.8%. But in others, like North Darfur, it was very high, 31.7%. And this variation might be a result of differences in testing and diagnosis facilities between the capital and the remote areas. Or it could be because the actual number of community cases in Darfur states are a lot higher than detected. In Sweden, for comparison, it is 2% case fatality rate, so much lower. And this tells us that testing capacity in Sudan is lower than it needs to be to detect all cases, especially in the remote areas. And it also tells you that the number 32,000 infected is gravely underestimated. Next slide, please. The work was performed completely remote. I used a lot of material provided by a very helpful UNEP Sudan, for example, their State of Environment and Outlook report for Sudan. And I also got some local research papers from UNEP Sudan. And I also used a newly published book, Integrated Risk of Pandemic, that came out in October 2020, I think, which was a compilation of the latest research at the time. And I also used a neat assessment tool from EE Center and adjusted it to an all-country level to do my assessment. Next slide, please. Thank you. The challenges in making the medical waste assessments was that I could not verify the local researcher data I was getting, and I had very little background information in this project. And I had no information on how much medical waste increased during the pandemic, or waste in general. We have seen a 6-fold increase in medical waste in China, and I think Mike spoke about a quadruple in some big cities like Kuala Lumpur. But Sudan is, in my best guess, probably seeing a much more moderate increase, and the increase will be seen mostly in Khartoum. Another difficulty is that even if practices are described to me, I have no means of seeing them for myself. Are they really managing the waste according to their routines or not? It's hard for me to tell. Next, please. And here is a part of my assessment. COVID-19 increased waste affects the environment through land degradation, contamination and pollution of land, soil and water, and also air pollution from combustion of waste. The capacity of handling medical waste from COVID-19 is a short-term challenge, and the overall management capacity of medical waste or healthcare waste is a long-term challenge in Sudan. Next, please. And here are some of the data I did get. Medical waste was around 1% of the total amount of waste in Greater Khartoum city before the pandemic, and Greater Khartoum city is a state. So it's not just a city, it's a bit of the suburbs as well. And the numbers I found varied a lot. It is probably around 1 kilograms per bed per day, which is a fairly low number. In USA, for example, it's about 6 kilograms per person per day, I think. And medical waste is believed to increase. Sorry, I wasn't finished. And medical waste is believed to increase, as like Mike discussed, both in healthcare and in households as well. And out of this 1%, of the total amount, 20% is believed to be hazardous, like toxic, sharp, or infectious in Sudan. And if infectious waste is not separated from non-infectious waste, like paper and packaging materials and maintenance waste, all the waste has to be treated as infectious. So it is important to keep the volumes down if the capacity is low. Next, please. And the Khartoum state produced about 3 tons of healthcare waste per day in a total before the pandemic. And the percentages of separation and segregation were 95 and 63 in private and governmental healthcare facilities in 2020. And only 17% of all medical waste in Khartoum is receiving separation and post-collection treatment. And the best practice for hazardous and infectious waste, as Mike told you, it is burning in an incinerator with a high temperature. And a study from Sudan showed that healthcare waste was instead in some cases discarded in public streets or got mixed with municipal solid waste. And this was believed to be because of poor working conditions in hospitals and healthcare facilities, and lack of knowledge and illiterate staff, and also lack of any regulations regarding medical waste, and also a high degree of non-compliance with the requirements of safe discharge of medical waste at designated dumping sites is reported. And this poses a threat to the health of people engaged in medical waste collection and processing, particularly the large number of informal waste separators found at dump sites. And few hospitals are equipped with waste incinerator units on site, and the vast majority transport the waste for processing off-site. And there are 585 healthcare facilities in Greater Khartoum city, 106 private hospitals and 49 governmental hospitals, and only 22 incinerators with unknown function. So the need is far greater than the capacity. Next, please. And the waste not treated as medical waste is managed in the regular waste management system in Sudan that has a capacity to collect about 2/3 of the waste. That means that 1/3 of the waste before the pandemic was dumped or discarded in unsafe or unregulated or even illegal ways. Waste is managed mostly by collection from outside the houses or buildings, and waste is then buried in landfills outside the urban areas. And the increased amounts of healthcare waste puts an even bigger strain to the existing management systems and adds to the ongoing pollution of land and water from waste. So this is a clear example of what Mike showed in the beginning. Waste management workers are believed to not have enough personal protection equipment or routines to avoid the risk of infection from the medical waste. So this unseparated management is a big health risk as well. Next slide, please. And these are some of the ingredients in the smoke generating from backyard waste burning. Nitrogen oxides, volatile organic compounds, carbon monoxide, and particulate matters, they are all considered air pollutants. Burning garbage in a barrel or pile produces more carbon monoxide than from decomposition in a landfill. And this is the reason incinerators or controlled waste burning sites are needed. They secure a good combustion that minimizes pollution, and the outlet of the smoke can be controlled and led in a chimney to where it can be diffused by wind and not cause health effects. This picture is actually from a newspaper from 2015 about contaminated medical waste that was burned in the streets of the suburbs of Khartoum. Next slide, please. And I think we actually had a question about wastewater. I will try and answer it here, I hope. Another important environmental risk is wastewater. There is an increased need for more water for sanitation and hygiene in a pandemic, for hand washing, cleaning and laundry, both in healthcare facilities and in households, of course. And this means more wastewater that needs treatment. It also puts a big strain to the water sources as well. And the situation is similar to waste in Sudan. Wastewater has proper treatment in Sudan, but not sufficient, and wastewater treatment is not available everywhere. So the risk of increasing pollution from improper wastewater treatment is a growing concern. Wastewater has not been confirmed to infect with COVID-19 yet, but viable virus particles have been found in wastewater in different countries. So wastewater from hospitals with COVID-19 patients need to be considered as a possible source of infection. And preventive measures, you can see in the green square, might be decentralization of treatment and adding small-scale treatment plants to the system, or improvements in the existing plants, and virus decontamination in healthcare facilities of the water before it is led to a plant. So I think the best measure is to try and treat the water better at hospitals before you lead it to the treatment plants, or maybe add more treatment plants on the way. Next picture, please. The risks identified for the environment from medical or healthcare waste in Sudan, they are increased amounts of waste into a system with poor management, and more waste generated in areas with no capacity to handle it will lead to more pollution by waste dumping, of course. More temporary landfills created will lead to soil degradation, and adding more medical waste to the system will add to the strain. So we might see a growing waste crisis in some areas, or maybe we see it already. If the waste is burned in barrels at the hospitals, the infection risk minimizes, but this causes local air pollution that is also a health risk. If backyard burning is widely used, urban areas will suffer from more air pollution and hazardous smog. The residue from incinerators, as Mike told you about earlier, that might be another seminar about waste from incinerators. It is to be considered hazardous. No information was available on how this waste was taken care of in Sudan. Management of possibly infected healthcare waste is a health risk to the maintenance staff, and we need to keep them at work because we need to keep the management of waste going. The need for water for sanitation puts a strain on the water supply and to the treatment plants, which will lead to more pollution from the plants. Next, please. And just to repeat what Michael and Ravi said, what is needed in Sudan is to work with a national or regional management system to investigate the possibilities of increasing waste management and investigate environmentally better managing systems like incinerators for hospitals and ensure full operation of them. And in the absence of appropriate technology, you can use the 3S method, that's sorting, segregating, and storing. And this picture is from the UNEP fact sheets. Links to them will follow at the end, and I think you have them already added to the handouts to this webinar. The fact sheets contain a good practice and strategies for the way forward in countries with Sudan's challenges. And different solutions are needed in camps or settlements, of course. But the process will be the same as for hospitals. First, we need to investigate the means of safe disposal, develop easy quick fix strategies, and make sure that they are just that, quick fixes, and that they are abandoned when a better practice is developed. And second, we need to assess the capacity. And the inventory table in one of the fact sheets, and also the inventory table that Mike handed out, is really good to use. And thirdly, we need to build capacity by training and gather knowledge about treatment practices. And it is also important to incorporate the informal waste pickers in the management systems to prevent them from losing their livelihoods. And some conclusions. For future assessments, it is helpful to ask these 4 questions. Is medical waste increasing, and where, and how can we get that information? What management system is in place, and how can we enhance it? And are there informal waste systems? How are the waste pickers affected? And can we cooperate with more actors? And to build back better is important to learn from this crisis and prevent similar disasters from having the same effects. So it is important to increase the overall capacity in hospitals and healthcare facilities for incineration and sorting of medical waste. It's also important to increase national or regional waste management systems in cities as well as in conflict areas. It is also important to increase the capacity for wastewater treatment. And my last slide is about some useful links. I think some of them are added as handouts. And here are the fact sheets on the top. And I also recommend to use the disaster waste management guidelines. And I also included the same construction manual for a brick incinerator as Mike had in his handouts. And I think also the WHO healthcare waste management guidelines are really good. And I also included a link to the Relief Web COVID-19 pages. Thank you.
Thank you, Ida, for this brief but very useful presentation from Sudan, which is probably repeated in a number of other countries, that there is already a shortage of existing facilities, and on the top of which comes the COVID waste. Luckily, so far, the number of cases in Sudan was not as high as one would expect in the early stage. But when we see India, which also had a lower number of cases, infections per million in the first wave, suddenly getting into a massive second tsunami, one should start to wonder whether this could also happen in other countries which escaped the first wave. Now we will go to the Q&A section. As I mentioned, there is a very high degree of retention of those who join the seminar. Large number of questions, but also comments and observations have come. There is a colleague from WHO who has provided links to a number of WHO documentations. We would extract them and we will also add them to the list of handouts which we are providing because they are extremely useful. Mike, there is a question from Shibu in India. Shibu has been working in the field of waste management for many years. His question is, if we take healthcare waste and autoclave it, can it then be sent to a recycling plant or recycling station? Are you aware of this being done? From your presentation, I understand that probably the best practice is to shred it, but can we recycle whatever is the shredded material? Do you have, not necessarily about COVID, but generally in healthcare waste, do you have any observations, recommendations, good or bad practices on this?
Yeah, by way of a general comment, when we're using autoclaves, it's good practice to shred it because it increases the efficiency of the sterilization of the waste. It produces a waste which is reduced in volume, which reduces the transportation costs, and also it improves the waste aesthetically in terms of it doesn't look like healthcare waste anymore. So shredding with autoclaving is very much the preferred way to go. There has been situations in some countries in which I'm advising whereby autoclaved waste, which is sterile and okay to go to the disposal sites, is not being accepted at landfill sites because it still looks like hospital waste. So if it's shredded, then you come over some of those problems with local authorities who are now fearful of handling treated healthcare waste. So in terms of recycling healthcare waste, I think it's difficult to imagine how you're going to recycle post autoclaving, particularly if we've had shredding, it's a non-starter. I think the best approach for anything to be recycled is we come back to waste segregation, and that which is suitable for recycling is segregated in the first instance rather than going through that waste treatment stream. So my meandering answer to that, Murali, is I'm not aware of any successful attempts to waste recycle after autoclaving, and indeed I'm not sure it's something that would be recommended.
Thank you, Mike. If even the waste management facilities are not happy to receive autoclave material, you can imagine, how fearful recycling industry in our organized sector would be. But there are unfortunately reports of people doing it even without autoclaving. I had seen some reports from some countries where PPEs and masks were actually being recycled as well as reused to make mattress and other things. So clearly something which happens, but probably not something which is recommended. Ravi, one question which is coming up is about single-use plastic. Just before this COVID surge came in, or COVID pandemic came in, there was a very large push on banning single-use plastic. A number of countries, including India, had set targets. But then COVID came and countries have gone back on this. So is there are there some suggestions you can make on how countries can get back on track? One thing. And number two, are there some countries already addressing these issues and tightening the regulations?
Thank you, Murali. Yes, I mean, pandemic has basically set aside a lot of ongoing projects and initiatives all around the world, right? This one being one of them. there are no, to my knowledge, there are no regulations that have been pushed forward at this time during this pandemic on the single-use plastic, but there are initiatives are still going on. For example, not too long ago, here in Canada, the federal government has come up with a proposal for handling single-use plastics. What they do is they differentiate between friendly single-use plastic or economically viable single-use plastic versus environmentally detrimental single-use plastic. And so, just like I explained in my presentation, there is a holistic approach that is required. That's what they have been doing. They have come up with a proposal, consultation document. They have distributed that openly to the public, asked for comments, and so various stakeholders are providing comments. And then this is going to take some time, but they are also talking to various regional authorities and whatnot, and coming up with what is referred to as a consistent, transparent, and comprehensive approach to ban of management of single-use plastic. And but it is still ongoing. It probably is going to be another year or two before anything can be seen at the national level. Yeah.
Thank you, Ravi. Ida, in Sudan or any other country which you have worked or you have been working, are you aware of national government or any other authority providing targeted support to city authorities to deal with COVID-linked healthcare waste management? Or is it that those agencies are basically left to fend for themselves?
I think it could be very different in different countries. I think that there are some organizations that provide this support, but I haven't heard of any governmental works. I think that some organizations are providing support for their own hospitals, their own healthcare facilities. But I think it should be coordinated better. I think we could help each other and back each other up here and treat each other's waste as well. And I had a question about how we can treat the medical waste in rural areas. And I think that could be a good example where you can build one of these brick incinerators, or even take the waste away from the inhabited areas and burn it where no people can be affected. I think that would be an easy solution. That was not maybe an answer to your question, but...
Yeah, thank you, Ida. Mike, we have been talking about, the waste recycling industry. Do we have some sort of statistics about, how waste recycling industry has actually been affected by the COVID crisis? It's not, is there a drop in price of, recycled material, etc., reported from some parts or other?
Yeah, I haven't got the latest figures, but certainly in the first 1 or 2 quarters after the pandemic, there was a noticeable drop in the market prices for certainly recycled plastic. And the ramifications, the consequences of that were many of the informal waste pickers, particularly in developing countries, were finding that the middlemen were no longer interested in taking the plastic waste off of their hands, albeit for a small and nominal fee. So it dropped in the first instance. I think there's been only a modest recovery in price, but certainly in many of the developing countries in which I'm still operating, very much it's impacted in the markets, the informal sector very much unable to offload to the same level recyclables, in particular plastics recyclables. And again, that's underscored or compounded by the then initial significant fall in the price of oil, making virgin plastics cheaper and more attractive. So it's had significant and profound knock-on effects throughout the recycling sector, most vulnerable of which, as we say, the informal sector of which. And I believe we're going to have a presentation on the impacts on the informal sector on a later webinar, so we can look at that in some more detail.
Thank you, Mike. Yes, indeed, we will have a separate focus session on the waste recycling and in particular the informal sector. So please continue to type your questions. We have a number of them. We will not be able to answer all of them today, but we will certainly pick and answer all of them. We'll prepare an Excel worksheet and we will actually make it available to the participants. And your questions will inform our next session, which is coming up, and I'll give details. So we have a question from Anna, who, we have worked extensively in multiple disaster-affected countries. And this question is to Ravi, and others could also answer if they're familiar with. The question is that while thermal treatment, including incineration, may be appropriate for hazardous healthcare waste, there are some countries where it's legally prohibited, such as Philippines. I actually didn't know this. So the question is how one could handle it. So question to you, Ravi, is are you aware of other countries where there's a legal ban on incineration? In such countries, could we maybe use a co-burning type of situation, such as a fuel additive? Do you have some sort of an experience on that? Thank you.
Yeah, right here in Ontario, in the northern part of Ontario, in Canada, the provincial government has banned or discouraged the use of incinerators. And primarily the reason is because these incinerators are not able to maintain the temperature that they need in order for full combustion. So it is not necessarily, they talk about design criteria, but then when people operate it, they don't wait for the temperature to attain 800 or 1000 degrees before starting to feed all the waste, because they want to cut down on fuel. So that's the human factors that come into picture. So because of that, there was incomplete combustion going on, and that was causing issues with the environment, receiving environment. So the short answer is there are two ways. One is people do it without the support of a regulatory regime. So that basically is illegal, right? That happens in places where the enforcement is not great. In places where enforcement is strong, then it is not allowed. It takes time for any permit or waivers to be brought in before they can start using. So that is my short answer for that.
Thank you.
Probably I would add to what Ravi said, that yeah, there are parts of the world where incineration is banned, and I think that will probably increasingly be the case. It's primarily because of concerns of furans, dioxins, heavy metals coming out of the stack. And there's certainly other alternatives when you're faced with a ban on incineration. I talked at length about autoclave, steam sterilization. It is becoming the preferred way of treating hazardous healthcare waste. The pathogens are killed thermally within a chamber, but it's not combustion. So we don't get the stack emission, we don't have the complications of highly toxic flue ash or bottom ash, which then creates a secondary waste disposal challenge. So most definitely, the technology of choice is increasingly becoming steam sterilization and modern autoclaving for the reasons mentioned.
Thank you, Mike. I have two questions, one from my good friend Sangeet and another from Gustavo. It's basically talking about how to deal with healthcare waste in one, very populated urban places, and number two, how it is handled in household, probably in quarantine in the Western world. If someone is quarantined, are their waste segregated, and how is it handled in cities themselves?
I can start with the second question there. I can only speak for Sweden. I don't know how it's treated everywhere else, but Here we have a waste management system that doesn't really involve anyone touching the waste. It's all automatic. So the only recommendation here is to double bag the waste.
Okay.
And then it's handled normally. And we also use incinerators. We create heat from the waste here in the city I live, so it's burnt. So I think that's an okay practice. And the first question, could you repeat that one?
It's about how hospital waste is handled in cities. I think the question is whether a hospital themselves should have some sort of an incinerator, as it is done in some countries, or should it be taken out of the city into a centralized area?
I think it is different depending on what kind of waste it is. If it's really, for example, radioactive waste that could be from hospitals, then it's treated very specially. But I think most hospitals here have some sort of incinerator that they burn the toxic waste at least, or the hazardous waste that could be infected. But I think sharp waste or waste that doesn't really have to be contaminated could be treated with normal waste. But I think most of them have some sort of incineration system or disinfecting system for the waste. So I think that every major hospital here has one, for example.
Well, if I could add also, Ravi mentioned about the proximity factor, which is to the extent possible, you want hazardous waste treated as close as possible to the point of generation because you don't want secondary problems with transportation and spillage and everything. So how that actually works in practical terms is COVID or hospital healthcare waste would be treated within the hospital if it's a large hospital, and if it's economically and practically viable for that hospital to have a treatment unit, increasingly, well, initially incinerators, but increasingly moving towards autoclave. So it's a function of geography and it's a function of scale as well, in terms of when you come down to small producers like clinics, centers, veterinary practices, it's not feasible they have their own treatment infrastructure. So there you would set up a dedicated collection service only focusing on the hazardous COVID waste, healthcare waste, collecting and bringing to one central treatment facility. So that's a bit of again, a meandering answer, but it's a function of how much is generated and it's a function of scale and geography as well.
Thank you, Mike. We have passed the time for the session. We still have 80% of those who joined, actually 90% of those who joined the beginning is still with us, which, as I said, is exceptional. Thank you for staying with us. We would continue the session. There are a number of questions, and if I just pick up a few, then still there'll be many left. So we would pick all of this and answer them and make them available before the next session. I want to thank all the speakers for their excellent presentation and being available to answer the questions. I want to thank Paula and also Rita and others who are working behind the scene to make this webinar work. You will all receive a certificate of participation shortly. If you do not receive, please get back to the organizers or myself. And we look forward to our next session, which is specifically on the informal and recycling sector. It's on 17th of June, which is, and the timing will be exactly the same. It will be 3 o'clock in Geneva and other timing in other parts of the world. So thank you. Good afternoon, good evening, good day to people around the world. Thank you all. Bye-bye.
Thank you very much. Cheerio.
Thank you. Thank you, everybody.
Bye-bye.
Thank you.
Paula?
Murali?
Yes, Murli.
Are we in private now?
No, they're still attendees, so we should log out of this session and then we can have a separate call.
Okay.
Or wait until the attendees leave.
So how about going on MS Teams for a separate call?
Yep, that works for me.
Okay, and webinar for all?